Assalamualaikum warahmatullahi wabarakatuh. My name is Musyaffa Dzaki santosa, number 032 from international class. I would like to present about Down syndrome. The definition of Down syndrome. Down syndrome is different genetic known as trisomy because the individual who gets Down syndrome has one extra chromosome. They have 3 chromosome 21, whereas normal people only have 2. Advantage, this chromosome will change the body's genetic balance and result in change in physical characteristic and intellectual abilities, as well as disturbance in the body physiological function. The etiology, so the genetic is because according to the research, epidemiology say existency enhancement risk over and over when in family exists child with syndrome Down. The radiation, there is in part big research that around 30% mother give birth child with Down syndrome ever experience radiation in area before accurate conception. Infection as an abnormality, autoimmune and abnormalities endocrine on mother, especially autoimmune thyroid or disease that link with thyroid. Age mother, if age mother above 35 year, estimate axis change hormonal ones could cause non-junction on chromosome, change endocrine as increased secretion, and beside that abnormality pregnancy to take effect. This is overview clinical. The characteristic of sufferers of this syndrome are appearance prominent physical from shape relative small than normal head with antero-posterior portion of the head horizontal. On the face usually appears between a flat nose, a narrow mouth, and a protruding tongue. Often the eye becomes narrow at the center of the corner, forming the fold. Clinical signs on other parts of the body include short hand, including knuckles and the distance between the first and the second finger on both hand and feet wind. You can look this picture. This is a Down syndrome. Okay. Next. Meanwhile, the skin layer usually looks wrinkled, dermatologic. This chromosome abnormality can also cause disruption or even damage to other organ system. In newborn, the abnormality can be congenital heart disease. This disorder is usually fatal because babies can die quickly in the digestive system. Abnormalities can be found in the form of blockage in the esophagus or duodenum. In the brain of people with Down syndrome, an increase the app ratio was found employed precursor protein as in people with Alzheimer's. Next, so you can look this picture. This angular cellitis and scrotal tongue. This is the symptom of Down syndrome. And this one you can look this teeth, the tooth, teeth. And this is the scrotal tongue and tongue face accompanying geographic tongue. And lip broken angular cellitis, and shape palate on Down syndrome. Candidiasis pseudomembranous is something infection opportunistic that caused by growth excrete from mushroom. Candida albicans superficial. Looks as plaque, mucosa that white diffuse cloth that could delayed and leave surface red, raw and bloody. Handling teeth and mouth in people with Down syndrome. In people with Down syndrome, mental and physical change are found that will affect the health of the oral cavity. For this reason, dentists need to know the patient medical history and determine who will be asked for informed consent for the implementation of treatment for Down syndrome patient. Handling in manner general, the pathology can help to teach the position of the tongue and improve adjustment of the orofacial muscle. In severe cases, tongue surgery may be indicated. Orthodontic are need to monitor tooth extraction during crowding treatment. An anesthetist is needed certain cases that require more extensive treatment with anesthetic drug, both like sedation and general anesthesia. Nutrition interaction parents or carer about dietary supplement due to the limitation of the chewing muscle of children with Down syndrome. And handling in manner special, preventive action administration of fluorine, systemic liquid tablet or mouthwash, typical are given after routine dental cleaning. Plaque control condition, children with Down syndrome quickly swallow their food and chew it a little, but food scrap often still collect around their teeth, especially with muscle hypotonia, so it is difficult to achieve good self-cleansing. The therapy, mouth rinse can be used to help clean up food residue in addition to mouthwash. Acts as an antiseptic. Pit closure and fissure sealant can effectively reduce occlusal caries. Curative action, giving a fill and tooth extraction. Rehabilitative, orthopedic care and denture manufacturing. Thank you for watching this video and see you.